bit about what we do at Myeloma Canada. So for those of you who don't know, we are a Canadian nonprofit organization. We are what is considered a patient organization. So when somebody gets diagnosed with multiple myeloma, we are the ones that will come in sort of as a wraparound service to their healthcare. So that would be everything from educational materials to support to advocacy to community events and everything in between. So hopefully this doesn't bore you too much, and I apologize for those who've already heard this. So Myeloma Canada was founded in 2005. We're going to be celebrating our 20th year anniversary next year. And we've grown enormously in our services over the last 20 years. But wheeling back into 2005, and I think Igers will speak a little bit about this in the timeline in terms of what multiple myeloma looked like back in the early 2000s. At that time, there weren't very many treatments available for the disease. The outlook was very grim. It was considered a very terminal disease. Anybody diagnosed with myeloma at that time was generally given anywhere from 2 to 4 years to live. There were no organizations in Canada such as ours. There was no, the internet wasn't what it was today. There was only a handful of support groups. And so you can imagine when somebody gets diagnosed with the disease at that time, you get diagnosed with a disease you've never heard of, you're told you've got 2 years to live, and you've got nowhere to turn. So Aldo Del Cal, who is one of the co-founders of Myeloma Canada, when he was diagnosed in 2004, that's exactly the freak out that he had, and very quickly decided to start a support group in Montreal. And that's where he met co-founder John Lemieux, and through discussions through their group kind of realized the need to bring education and awareness of the disease kind of right across the country. And so, lo and behold, a year later, that's when they founded the organization. And it was sort of a garage basement type of organization for a couple of years, but it's expanded enormously in our offerings. So what started as an education and awareness type of organization has grown into our promise, which is to accelerate access to the best possible care. And our goal is to support the pursuit of its cure and its prevention. And that's a lot of the work that what you guys are doing today in terms of diagnostics and how can we help improve diagnosis and maybe sooner as well. So in our offerings, we offer 5 different pillars, which I'll kind of go through briefly today. And if you have any questions, just feel free to cut me off at any point. So in terms of education, we provide educational conferences. So these are kind of full day conferences. We bring in everybody that's kind of related to the healthcare journey. So whether that, researchers, nurses, physiotherapists, nutritionists, and sort of everywhere in between. And it's kind of a day to kind of get all the information that you need in terms of living well and managing the disease in whatever community that we're hosting across the country. So we actually did 3 this year. We had one in Toronto, Vancouver Island, and in Red Deer coming this fall. Info sessions are sort of half-day sessions where we kind of go into communities that doesn't necessarily have a support group or they're not necessarily near an academic center. So for example, we've got an info session that we're hosting in Fort McMurray tomorrow. And this is just an opportunity to bring community together for the first time. Often we get a lot of newly diagnosed patients who are just kind of scrambling to find information, and it's a really good time to kind of, you go to your doctor's office, you've got like 10 minutes with them. Well, now we've got like a full hour, so it's just a really good time to absorb some information. Educational videos, we've got, you've got a question, we've got a video for that. So we post all of our videos up on our YouTube channel. We've got hundreds of videos on there, everything ranging from recorded webinars to educational presentations to whiteboard videos. So if you're looking just to have some simple information on what is myeloma and what the experience is all about, those whiteboard videos are kind of like those cartoon type videos that they like draw concepts in sort of an easy way. And so if you're looking for, again, for those if you're interested, you can just go to Myeloma Canada YouTube channel, and then on there's a little search button, so you can put in any keyword, and it'll like the information will come up on there, anything that relates to that. Our website is kind of the mothership of all information. Everything you need about anything related to myeloma is in there. This is our version 3.0 that we just launched this past January. We kind of reorganized the information. There's not much that's new in there, but just sort of reorganized it because we realized that when people come to our website, they come at various different stages throughout their treatment experience. and often, and what they are looking for is very different at those stages. So when you're newly diagnosed, you might be looking for information on treatment options, prognosis, stem cell transplant, support groups, etc. And because myeloma is a relapse and remitting disease, often, when people are starting to relapse, they'll come back to our website and looking at that type, maybe clinical trials at this point, maybe looking at, again, different drug options, or maybe they've been living with the disease for a very long time and are looking for, financial information or mental well-being resources. So we've kind of broken it down through recently diagnosed, experiencing a relapse, living with myeloma, caring for somebody, so for caregivers coming to our website as well, and then getting involved as a volunteer, etc. Our print resources, so these are things that when a patient gets diagnosed, most often in a hospital setting, they get handed the unwelcome package from their healthcare team, which has all of the information about what the disease is all about in there. So they are all available in print and in a PDF version online. And we've also got things like info sheets, which are kind of like 8.5 by 11, just kind of quick information on specific types of topics that don't necessarily require a large brochure. And our glossary, so I'm sure as you'll hear a lot today, and I'm sure throughout as you were starting to learn about multiple myeloma, it's like learning a whole new language. So you can imagine a patient who's getting diagnosed who has no experience with the disease whatsoever. It's a lot of terms and a lot of acronyms, and a lot of acronym soup actually. So we've created this really easy tool online where you can just type in the word and the definition will pop up. We've got hundreds and hundreds of words on there, so as terminologies expand and as more words get added to the list, we add them regularly in there. So the good news is people are living much, much, much longer than they used to. As I mentioned before, 20 years ago, 2 to 4 years, and now we're looking at 10 years plus. I know many people that are living 20, 25, 30 years with myeloma as well. So more and more living well and having a good quality of life with myeloma is extremely important. And being able to live with what we're calling now chronic illness. So we're kind of shifting our terminology from terminal to chronic, which is a great story. I'm not quite at cure yet, but we're getting there. That C word's coming out. It's in discussions a lot more than it ever used to be. So we created a nutrition program. So this can be useful for anybody. So Jill Compton, she volunteered her time. She was a caregiver for her mom who had myeloma in Ontario, but she actually lives in the UK. She's a registered nutritional therapist and a natural chef, so she volunteered her time to develop some delicious recipes for us. So if you're interested, they're not just like kale salad kind of stuff, but if you want to, there's some fish recipes and some dessert energy bites, smoothies, soups, all that kind of stuff in there as well. And they are available in like print format that have like less color on them, so they don't take up as much ink if you'd like. Exercise is a big one for anybody, really, but of course staying active is always something that we all should be doing, but especially for somebody who's living with multiple myeloma who have a lot of bone involvement, sometimes they can be quite crippling, and so staying active can be quite challenging. And so we partnered with an organization called Revive in Ontario. It's a physiotherapy organization, and we worked on a pilot project with them as a research project where we had a bunch of people living with myeloma work with a physiotherapist to develop several exercises that would be useful and beneficial for patients, gentle exercises. And here, lo and behold, we've created these 5 exercises that are available in text sheets and in videos, and they're things that are very, very simple that you can do at home. It's on a chair or on a counter or on a wall. So it's just kind of things to help keep you moving, and they're very gentle. So again, anybody who just wants to stay a little active can have access to those as well. So awareness is a big one, and I think this is kind of part of where you guys fit in and the work that you do. We look at it in 3 different buckets, so to speak. So we're looking at bringing awareness to healthcare providers, and that's pretty huge as well. So that's not only our researchers and our hematologists and keeping them up to speed on what's the latest and the greatest in myeloma, but also family physicians and nurses and physiotherapists and people who are maybe before the diagnosis phase and can learn to recognize what those signs and symptoms are and perhaps give that referral a little sooner. So there is studies that are showing that patients receive at least 3 visits before being suspected for multiple myeloma. So we want to be able to bring awareness to those frontline healthcare workers to be sure that they are aware of what to look for in multiple myeloma. So we take part in medical conferences with the support of Sebia, of course, you see that picture down there. That was at the Family Medicine Forum, I believe. Nursing conferences. We also publish in medical journals. We do accredited medical education programs, which I'll talk to you in a moment. And we also do in-service visits and education days in hospitals, so bringing awareness to the healthcare team as about what resources are available for patients as well. And so how many of you, just before you started working in this field, had any idea what multiple myeloma was or even heard the word? Right? So now imagine a patient getting diagnosed with the big C and then being told you have myeloma and you're like, what the heck is that? And so what would you immediately do when you go home? Just Google it, right? So we spend quite a bit of time making sure that when you do go home and you do Google what is myeloma, or prognosis, or symptoms, treatments, life expectancy, all those kinds of things, that our Myeloma Canada website shows up in the top searches because we want the internet to be a real deep and dark place and a lot of misinformation out there, so we want to be sure that patients have access to correct and up-to-date information. And if you're a social person, you can follow us on all the socials. Multiple Myeloma Awareness Month is in the month of March. That's an internationally recognized month, and each year we run a different awareness campaign. And this year was really, our campaign was revolved around diagnosis. And so the theme around this was for the general public to recognize themselves if they are experiencing signs and symptoms, to maybe ask the question or seek out help. And maybe sometimes it takes, like a back pain, well, you let it persist for 1.5 years before you have it checked out. So by kind of prompting these questions or these things that maybe will allow people to learn a little bit more about the disease and maybe ask a few more questions to the healthcare team. So we had several personas or people who are living in our community share their stories about how they got diagnosed. Laura Lee, who we met yesterday, she broke a rib when she was planting flowers. I met somebody in Ontario who, she very publicly shared in a podcast that she found out she had myeloma while she was having sex. And so that we actually were going to post that. I thought, okay, maybe that's a little risque, but if you post that in a post, wouldn't you want to go like, okay, what the heck is that? Well, we click on it. So we kind of wanted to make it sort of like a clickbait type thing to bring you to our site to learn like what is this disease and what are the symptoms and what should I be looking out for. So the symptoms, we'll hear a little bit later, can be vague enough. So for somebody being diagnosed with myeloma, they can be just experiencing a lot of fatigue, like with a lot of things, persistent back pain because it's in the bone marrow. You get a lot in the spine, in the sternum, in the ribs, in the hips. So you shovel, you're gardening, and things, you throw your back out. These are kind of things that happen as we age, right? So we don't think to question them. Or people who get frequent infections that, I just can't seem to shake this cold. It's not going away, or it keeps coming back. So we just want to, again, bring those vague symptoms to the forefront a little to say, hey, if this is really not going away, I think I should reach out and sort of talk to somebody. So advocacy is like the unsung hero at Myeloma Canada, and why? Because we can invest all the money in the world in research, but if we don't have access to that research, well, it's not going to help anybody. And so a lot of the work that we do is we want to ensure that we are shortening the timelines from when a drug gets approved by Health Canada to get reimbursed and picked up by the provinces, because, as I may or may not know, when a drug gets approved by Health Canada, all that means is that it's available for sale in the country. Nobody's paying for it at this point unless you have private insurance. And it goes through a series of different review processes before a province will pick it up to reimburse. And in that process, there's an opportunity to bring the patient voice and their experience with that drug or technology to these reviewing agencies. And what they look at is the clinical trial studies, so the facts and figures and numbers on the page, and they couple that with the patient experience, and then they compare it with what's already available on the market to decide whether it's worth reimbursing that drug or not. So they'll give a recommendation to the provinces on what they, it's a very complex review, but the patient voice is an extremely important part of that. We also host legislative action days, so we meet with, depending on the province or the issue, we pick on a province and we'll attack certain issues that may be related to a population in that area. So as an example, as I mentioned yesterday, you guys know, you sure heard the word of daratumumab, I'm sure, with comes to your testing. So that drug became available in Canada in about 2016, 2017, about where it was reimbursed everywhere, in the whole country, except for PEI. And that was not available to patients up until last year. And so we hosted legislative action, I wouldn't say not even just a day, it was more like months, with about 13 or 14 different government representatives. We brought in patient representatives to share the stories. We went to the media, and then just a few short months later, it finally got listed onto the formulary. And the same for the territories as well. So those are the types of things that we do because we want to ensure that patients have the best possible access to the treatments that they need. And talking about access, learning about the daratumumab, try and say that correctly the first time. So we created a map, especially again for patients who have very new to this journey, have no idea what these drug names are, what they mean, what's available in their province. Sometimes they just want to know how many cards they have in their deck. So we created this interactive map. You can click on whatever province you're in, and then that list will show up on the right-hand side, and then you can just click on the plus sign to know when the drug was Health Canada approved, and then in what conditions it's reimbursed. And then of course, as drugs get added, we add those to the list as well. And if you're looking for a clinical trial, just out of curiosity, for regardless of the disease that you may have had experience with, has anybody ever tried to Google clinical trials? A clinical trial. What's your experience been like?
It's tough to find info.
You're like, what the hell am I looking at, right? Yeah, so me personally as well too, and when I was looking for clinical trials for my dad, you kind of don't even know where to start. Is this available in Canada? Is this available in Montreal? Where do I go? Who do I ask? So it can be very daunting. So what we decided to do was create a very simple search engine on our website. It pulls from a site in the US called clinicaltrials.gov, which is a kind of an international site that hosts all the different trials for all the different diseases that you can search on. There's hundreds of thousands of trials on there. And so what we did is we created a search engine that will pull just myeloma just in Canada. So it goes from hundreds of thousands to like 50. And then we added some filters to it. So that in the green part is where you can put in specific information to use. So you can put in your postal code with how many kilometers you'd be willing to travel. You can put in your disease phase, so whether you're in the smoldering phase or if you're newly diagnosed or if you're experiencing a relapse, because trials can vary for that. You can put in a keyword, so you're looking for CAR T, for example, you can put in CAR T and then the trials that would relate to that keyword would pop up as well. And then we also deliver it in sort of bite-sized information, so it's very snapshot looking and not so daunting to read. And then if you are looking to expand on the entire trial, inclusions, exclusions, all that kind of stuff, then you can kind of read more. Also, it's a great advocacy opportunity if you are perhaps experiencing a relapse and want to explore your disease options. Maybe there's a trial at your center that it's not at your center, but it's at the center next door. It's always a good option that you can print it out, bring it to your doctor and say, hey, is this something that would be useful for me? The advocacy handbook is an important one. So this is an online document, it's about 50 pages worth, and it's really meant to help guide patients on how to be their best possible self-advocate. That's extremely important. I think we undervalue how important it is to be able to speak up for yourself. You are the expert of your body, and no one, two patients and people are the same. So how to be able to self-advocate to your healthcare team and to your surroundings becomes extremely important on a myeloma journey. How to be able to advocate for others as well, so whether it be through a family member or maybe a member of your group or your community, or if you have an interest, I'm not sure if you'll touch on this or not, but how to advocate for change. So like Bev, for example, she's on our advocacy committee and looks at various different health policy issues across the country that we work with the community on. So we couldn't do what we do alone. We are a very small team at Myeloma Canada. We are a national nonprofit, but we're only 13 folks that take care of a very, very large territory. I think you guys as well. I think you're 13 as well, right? So you know what I'm talking about. So we do what we do with lots of different folks. So we work very well with the, what we're going to call our sort of our sister organization, that we're actually very, very tightly entwined with the International Myeloma Foundation and the Global Myeloma Action Network. Locally here, there's the Southern Alberta Myeloma Patient Society, which is the Calgary group that is also a registered nonprofit as well. And then we work beyond our myeloma walls with other like-minded organizations to advocate on issues that are common to all of us. So health policies, health policies, health policy. If a breast cancer group can help advocate for a health policy issue that's going to benefit myeloma patients, then why don't we partner together? So that's the kind of some of the initiatives that we take on with, Connected and the Coalition in Quebec and the Victimes des Pesticides in Quebec, etc. So community empowerment, this is probably one of the more important pillars, just to ensure that patients and people living or helping somebody living with the disease have the right tools and they're equipped to be able to have the best possible conversations with their healthcare team and live their best quality of life that they possibly can. Because as I mentioned, no two myeloma cases are the same, they shouldn't be treated the same. So being able to ask the right questions at the right time, have the correct information, how to know to assert yourself, how to find support, feel supported and have those tools becomes extremely important along the way. So we want to make sure that we are at the forefront of that. So one of the things we do is we foster and support a network of support groups right across Canada. When I started in 2016, there's probably about 10 or 12 support groups at the time. We're up to about 50 now. Just started our first support group in the territories last week, so that's quite exciting. But this is a really good opportunity for people to come together. They're all volunteer-led, every single group. We are just there to kind of support and kind of put things on the ground. But it's a really great opportunity just to hear the other people who are living with similar challenges, who've been there, done that, ask questions. Sometimes it's like, oh, your doctor gave you that, how come they didn't give it to me? Oh, maybe I should ask that question. Oh, you had that scan? I didn't get that scan. Maybe I should get that scan. And it just kind of prompts questions and ideas that kind of help better equip you when you have those conversations with your doctor, or, you know what, someone mentioned to me about this drug because they were experiencing this particular symptom. Is that something that would be right for me? So these become extremely valuable, an opportunity to get the information that you need, and also, again, to find that emotional support for people who have been there, done that. And then we've created this support group map using Google. Is awesome for a lot of things. And so this is a customized map where we drop pins for all of our support groups on the map. You can put in your postal code and the distance you're willing to travel, and it'll lasso the groups in your area. And then you can click on one, and each group has their own page. We've also populated it with all of our American groups with the IMF. So for those who travel south for the winter and want to look for a group, or they live along a border community, then they can share resources with each other. So more and more people are looking for information online, for support online and at their fingertips. So we have groups that we run through Facebook. They're closed groups, private groups. They each request to join access, and they're kind of broken down based on, on specialized groups. So we have one for veterans and ex-military, we have one for francophones, we have one for amyloidosis, which is a sister disease to myeloma. We have one for caregivers only, one for young patients and caregivers. It's just, again, an opportunity to ask a question for anybody in the country and just kind of get some feedback from your peers. And then through the experience, the extremely positive experience we've had with Facebook groups, we decided to develop our own community through kind of proprietary platform, and we've named it MC Lounge. And the idea behind this is that it kind of takes Facebook groups on steroids, pun intended. And so this is an opportunity for people to join groups, and they can do very much so like they do with Facebook and have those conversations in those specific groups. But also an opportunity to find people. Facebook's like, we have people joining our groups and they go, does anybody live here from Calgary? I'd like to. And then if you don't see the post, you don't see it, and it's gone, and the algorithms screw things up, and then ads start popping up, and then whatever. So this is a space where you can put yourself on a map. You can actually go to the map and see the members list, and you can private message people in your community, especially if you don't have a support group in your community and you just want to connect with somebody local. It's a good opportunity to do that. It's a space where we can also post what's new and in the moment. So kind of like a Twitter feed, like where we can just post in like new resource, do this, do that, events, any volunteer opportunities are in there as well. And of course it's available in multi-language. But the really neat thing about it is that it's a login only, so you can't access it just by being anybody. You have to create a profile and be accepted through the platform through us, so it's very private, very safe for people to share their experiences. And then we have a peer-to-peer support program, so people just often, specifically around new diagnosis, around transplant, patients just want to talk to other people who have kind of been through similar challenges. You can read it in a book, but actually talking to somebody who's kind of gone through a transplant can be very scary, and the way it's presented is very scary. And so just again, talking to somebody who's gone through the steps, and maybe go, oh, you know what, be sure to bring your own pillow, be sure to bring, movies, you can bring in an exercise bike to your room if you'd like, or what have you. So just sometimes it's just those useful conversations that can really help calm and settle some of the anxieties that we have. Our Patient Advisory Council is a group of representatives that represent geographically our community from coast to coast. These are all folks that are living with myeloma themselves and kind of act as the intermediary between Myeloma Canada and our community, and sort of like a push and pull type of relationship. So all of the new resources that we put out get reviewed by the Patient Advisory Council to ensure that we're accurate, that we're not missing anything, that it's understandable, and that it's useful or not useful. And also to our support groups and community to make sure that information is being translated correctly, that it's any feedback that comes back from the ground, that we kind of get the feedback and ensure that we kind of stay on track. I think that's all I want to say about that. Yeah, and so as I mentioned earlier, community empowerment is a really big one, and being able to be equipped and ask the right questions and be prepared with your healthcare team to be able to manage your unique disease is vital along the way, especially as people are living longer and there are a lot more disease options on the table. So we created a microsite to speak specifically to this. It's not an educational site in the sense like you're not going there to download a brochure, but you are going there to get tools to be able to, again, prepare yourself for those conversations. So a discussion guide is an example of that, where whether you're newly diagnosed or you're experiencing a relapse, you can print out a form, and there's some preset questions in there to be able to prompt questions with your healthcare team that you may not think of. Most people get diagnosed, then you just heard the C word and you don't know what to ask. You don't know what to ask if you don't know what to ask. And so we kind of help guide you with those things that may open up those doors and open up those communications lines with the team. A decision-making guide is once you've had those discussions with your healthcare team, then sometimes you've got to walk yourself through some really difficult decisions. And how do you do that? And it becomes overwhelming. This was stemmed from a conversation that I was having with somebody in Ontario a couple years back, and she had as I mentioned, like myeloma, your relapse and your remission. And so she had a good 6-year remission after her transplant, which is considered a decent remission, and her numbers were starting to climb a little bit. And this was back in 2015 or 2016, and her doctor had said, hey, at that time daratumumab was not available, it was still only in clinical trials. And her doctor had said, okay, so your option is you can get a second stem cell transplant because you've had a good remission with the first one, or you can go onto this clinical trial for daratumumab. So how do you choose, right? What are my options here? So she had to go home and kind of walk herself through, okay, if I get the second stem cell transplant, I may never be able to get access to daratumumab because maybe it'll never get covered and be available in my province. Or if I go on the trial, I may never have access to a second stem cell transplant. So those are really difficult conversations to consider. And you have to consider a lot of things. Am I working? Who else is involved in this? How often do I have to be at the hospital? What does this mean for side effects? But it's for all the different things that you need to consider. So we created this sexy version of a pros and cons list, and it It allows you to either come to a conclusion yourself or maybe prompt some questions that go, before I make my decision, I need to ask some more questions. And then if you're a tech person, we created a disease management app that is available through the App Store on your phone, tablet, or computer. Many people who are battling lots of different illnesses carry binders around, and I see a few of you smiling because you understand the binder. Lots of different, your blood results, your prescriptions, your contact information. Sometimes it's a journal of monitoring your blood pressure, or your fever, or what have you. So this is just kind of the online binder that kind of puts everything together. It's also a way to help people feel less anxiety about managing what's the unmanageable. It's in a way to kind of put all of your thoughts in one place and feel like, if you feel organized, generally your stress and anxiety levels come down. So it's just an opportunity to keep things all in one spot. So again, it's available, like you can put it on your phone or you can put it on your computer. It's a really great opportunity. Even I just say just put your prescriptions in there, put your emergency contacts and your healthcare team in there as well. So if you ever end up in the emergency and then they ask you, what drugs are you on? I'm like, oh dear, pink one, I don't know, right? So you can go, here we go, and here's my list of drugs, and as you're getting triaged, and that's, makes things a lot simpler. And then finally, in science and research, each year we host a Myeloma Canada Scientific Roundtable. So Sebia was invited to join us last year, and I think you're joining us again this year. This is an opportunity to bring all of our Canadian researchers, clinical research nurses, industry partners, patients, government officials to the room together for a weekend to learn, to exchange with each other on basically the latest and the greatest of what's happening in research in Canada, to build collaborations, to discuss new clinical trial ideas, to discuss what's going on internationally and how that's applicable in Canada. It's just a really great space to understand and feel in the room basically what our Canadian healthcare team is doing and how they do not work in silo. And they really do work as a national team and a national network, because we've got physicians in Calgary who are working very closely with physicians in Ottawa and physicians in Edmonton to Vancouver and everybody in between. And so it's really comforting for people to know just how much clinicians are passionate about what they do, but also work together to advance things forward. So I think Igers will talk a little bit later about the IMWG guidelines and what that means in terms of the diagnosis and treatment of myeloma worldwide. But in Canada, that sometimes it doesn't always reflect our reality. So a couple of years ago, we heard of the cats with a group of researchers from across the country to develop a consortium to develop our own Canadian version of those guidelines. And we're on our 4th guideline now. They are published, they are available in medical journals if you are interested, and they are on our website as well. And it's just kind of, the idea behind this is just to ensure, Canada's a real big place, a lot of landmass to cover, and a lot of different centers where people are being treated, from academic centers to small community hospitals. And so we want to ensure that Canadians have access to the best possible care. And so by having these guidelines, it kind of sets the gold standard. And then with that, we've created a continuing medical education program where really now the target going forward as of winter 2024 is for primary care providers, for nurses, and for community oncologists to get up to speed as to what that gold standard is. So this is a self-assessment program, so they don't need to actually physically be in a room such as this one. They can complete the course online, and then they have to fill out sort of an exam at the end and then get their credits that way. In terms of our research priorities, we embarked on a program a couple years back called the Myeloma Priority Setting Partnership. I think we are the only ones in the world that have gone through this process for myeloma. We partnered with the James Lind Alliance in the UK, which is an organization that specializes in priority setting, and Horizon Health in New Brunswick, and basically went out to our community and we wanted to know, we do a lot of fundraising and we invest money in research. Where would you like to see us put that money? What's important to you? And so through this very lengthy process, it was over 2 years, what started as 4,000 research questions coming through from our community, and working through and paring those down and prioritizing them, we finally came out with a list of top 10 questions that was then peer reviewed and published in a medical journal, available. We actually got contacted from a few different countries looking for that information as well, and that's what guides our research investment initiative going forward. So basically all of the research that we do has to speak to one of those top 10 priorities, and within that, all of the research has to have a direct impact on improving patient quality of life, has to have a direct impact on increasing access to new therapies, and or contribute to healthcare system improvements. So we created as I mentioned, Aldo was one of our co-founders of Myeloma Canada. He was a patient himself and unfortunately passed away in 2019. And in his honor, we created the Aldo Del Call Research Grant. So it's an opportunity for research to apply annually for a research grant. Grantsa, we give out several. And within that, the donors have to apply for a program that fits within one of those top 10 priorities. We also have partnership grants, so we partner with other nonprofits on programs that would be mutually beneficial. Through our walks, we host 40 walks across the country, gives an opportunity for researchers to apply for local funding grants through the walk that is closest to them. We recently just partnered with the Leukemia and Lymphoma Society of Canada on a joint grant for a common project. And if you're interested, this is an old slide, we have a 2023 one, but if you're interested to know where we invest our research dollars, it's all in our impact report that we publish on our website. And then by the end of last year, this was a very, very, very lengthy and gruesome process where we got our Imagine Canada accreditation. This is a process that is an organization in Canada that kind of gives the seal of approval, gold star, level 1, I don't know what you want to call it, for nonprofits in Canada. So basically they look through absolutely everything and ensure that we are well governed and ensure that we do what we say we're going to do and that we are good stewards of donor money. So down to, I was mentioning yesterday, is like down to like the level of detail on our tax receipts we had, and this is one of the things they came back with feedback. Our printed tax receipts, you have to put on your tax receipts a link to a CRA website that talks about donations. The link that we had was the correct URL on the tax receipt, but when you clicked through to it, it brought you to page 1 instead of page 2 or something, and that was like, oh, sorry, you went to the wrong link. So that was like the level of detail that they were going through for those things. So we're pretty proud of that. That's kind of one of the only things that they were picking on. I'm like, okay, we'll take it. So it's just a good opportunity for our donors to know that it's an organization that they can trust. And lastly, we recently partnered or joined the Canadian Cancer Research Alliance as a new member, and this is just an opportunity to be able to seek out research opportunities and partner with other organizations who maybe have a similar interest in some programs that we're into. So as I mentioned, we partnered with the LLS and which we'll be continuing again this year. We partnered with Cancer Research Society, and we're looking to partner with a few others because basically at the end of the day, our research dollars are finite, so if we can deepen the pot by partnering with other people, then it's only going to benefit patients.